Tell us a little bit about what prompted you to feel like this was something that was worth your time.
Well, the idea of the meeting is to design a trial using non-invasive imaging, coronary calcium scanning, to see if we can identify a patient subgroup that benefits from that additional screening on top of the usual way we assess risk in people who have no symptoms. So designing a trial is the funnest part of clinical research, and that's why I'm here.
So why should the average folks out there who are living their lives and maybe they stumble across this as a news story or something, why should anybody care about what a bunch of cardiologists and researchers are doing about heart attack prevention?
Well, the really cool thing specifically about coronary calcium scanning is that even if you feel completely fine, you have no symptoms, even if you have a stress test that's completely normal, you cannot know if you have atherosclerosis that places you at increased risk of having a heart attack. Yet, insurance companies generally don't pay for this test, and many of us think that this might be a great way to identify people who need more intensive therapy to prevent a heart attack. But in order to really implement such a practice in the way we practice medicine, we need to have a trial. So that's my answer. Sorry.
No, that's fine.
We'll just cut this out while I'm blabbering.
No, that's good. I've heard somebody mentioned it's kind of like a mammogram for the heart. Is that a fair way of kind of making it very simple?
I think that's a very reasonable analogy. In some ways, very similar. Sorry.
One more question, and then we'll cut it off. There's an awful lot of these studies, as we heard today, already being done, already years ago having been done. So why is another study necessary?
Well, there's a difference between observational data, observational research, and experimental research or clinical trial research. The highest form of evidence is when we do a randomized controlled trial to prove that one strategy is better than another strategy in treating disease. So we really need to do a trial rather than just use observational evidence, because observational evidence can turn out to be wrong. For example, all the epidemiology of using estrogen in postmenopausal women would have led us to believe that estrogen prevents heart attacks. Turned out in clinical trial, not true. And there are other examples. So we need clinical trials in order to prove whether or not there's a value in adding coronary calcium to the way we assess patients' risk.